Hi, and welcome back to Hey Doc, What's Up? I want to complete our series on polycystic ovary syndrome, and we were talking last time not only about the times that a particular patient may be at age appropriate versus age inappropriate levels. You may be a once every 4 months that you're up at normal levels. You may be a once every 8 months. The worst that I had was a patient that once every 16 months, she was only up at age appropriate levels. Trying to get pregnant when you're not making appropriate hormone can be a very difficult task. And your first thought would be, well, I'll just take hormone. Well, it's hard to get enough hormone in you when we're adding it to what your body isn't making enough of. If instead we check you on day 3 of your cycle to see if you're making enough estradiol, chances are we can work with the rest of your cycle. We may even need to work with Clomid to make sure that you fully ovulate, making certain you make enough progesterone. But the key is checking day 3 estradiol levels. If I can check a day 3 estradiol, even if you have polycystic ovarian syndrome and your day 3 level is too low, I'll tell a patient, enjoy your month, enjoy life, and we'll check again next month. Have relations with your spouse for fun, for what you really got married for in the first place, for each other, and we'll try again next month and see what your level on day 3 is. More importantly, again, once you get pregnant, your body just clicks into pregnancy mode, and it doesn't care that you were here versus here. It just knows you're pregnant, and as long as we make it for you past the first 3 months, the placenta is healthy enough that you have a healthy baby, your body knows what it needs to do. And it doesn't care that you're polycystic ovarian. You are going to carry and make appropriate estradiol progesterone levels past that first trimester, and you are not going to need to worry about supplementing hormone after that. But what you may need to worry about is that polycystic ovarian syndrome patients have insulin resistance as a higher possibility of what else can happen to them. What that means is that you have a higher incidence of potentially having prediabetes or diabetes. Put the extra stress of pregnancy onto that potential for an insulin-dependent diabetes. You actually may therefore be diabetic during your pregnancy. You may require just diet management, but you may be unlucky enough that you will also require insulin because of becoming diabetic because of polycystic ovary during a pregnancy. Does that mean that once you deliver, you are now diabetic going forward? No. The really good news to that is that it is a tendency when your body is stressed that you will be put into a position that you may become diabetic, may even require insulin. Once you deliver and you are now postpartum, that extra stress and strain of pregnancy is taken off of your body. Many patients revert back to normal blood sugars, normal insulin levels. However, a second pregnancy, it is that higher likelihood that it will not only be a diabetic pregnancy again, but it may be that require more insulin, or that it's a higher dose, or that it'll happen sooner in the pregnancy. It also means that once you go forward into your 40s and into menopause and beyond, that you have a higher incidence of becoming diabetic later in life. So if you in fact have polycystic ovary syndrome, yes, it's kind of a rotten trick that Mother Nature has played on you. It's a rotten trick from a genetic standpoint, but knowing how to manage it is even more important, to know what you can do to give yourself a healthy pregnancy, a healthy baby, and a healthy life going forward. So, see you next time on Hey Doc, What's Up?